I am an Ayurvedic psychotherapist, a passionate infopreneur, edupreneur, and medical writer. I am on my pursuit of a mission to address, promote, and propagate Ayurveda and psychotherapy globally. In this pursuit, I conduct or organize discussions every week on Ayurveda, mental health, psychotherapy, and related topics with the professionals from the field. So, this Sunday afternoon, I am back with another discussion. So, this discussion is a continuation of my Ayurveda Awareness Series. So, this discussion we are talking about authentic Ayurveda and evidence based practice. So, when I talk of authentic Ayurveda and the essence of Ayurveda, it is relatively fragmented if I don't uh, comment on how what differentiates Ayurveda from other medical aspects, so other medical fields. So Ayurveda has a unique understanding of the body. Like Ayurveda has a holistic approach of healing rather than a symptomatic or a organ based approach. That means every individual is considered as unique and has a unique constitution known as Prakriti. And Ayurveda is the only science which talks about protection and prevention of the health of healthy individuals. That is swasthasya swasthya rakshanam and atarasya vyadhi parimokshanam. Ayurveda believes in wiping out the disease from its root cause. We call it samprapti in Ayurveda. Ayurveda believes in finding out or diagnosing the pathogenesis and wiping it out from its root cause. And Ayurveda is also a well documented system of medicine. It is a time tested, there are time tested techniques in Ayurveda which makes it precisely measurable. So, in olden days, Ayurveda was called Mana Pramana because everything in Ayurveda is precisely measurable. The quantity, the dosage, the strength, the time period, etc. Everything is measurable in Ayurveda. So it was called Mana Pramana. And health, according to Ayurveda, if you hear the definition of health, it is really unique. Like Samadoshaha, Samagnishcha, Samadhatu Malakriyaha, Prasanna Atma Indriya Manaha, Swasta Ityavidiyate. So, doshas, we have three doshas in Ayurveda. I think most of you might have heard Vata, Pitta, Kapha, and three gunas, which relates to mind. That is Sattva, Rajas, and Tamas. The health of the balance of these three doshas and Agni. Agni is your digestion and your metabolism. If your metabolism is good, Samadhatu, all your body tissues. That is, we have seven tissues according to Ayurveda. That is your lymphatic system, blood, your muscle, your adipose tissue, your bone structure, your reproductive tissue, and the bone marrow. These are the seven tissues. If these seven tissues are in balance and malak, the excreta, all the excreta, the urine, the stool, and the sweat, if they are in balance with prasanna atma indriya manaha. Atma also has a major role to play in Ayurveda. Atma is consciousness in Ayurveda. Indriyas are all your sense organs and organs of actions. We have five sense organs. And manaha, manas also plays an important role in Ayurveda. That is, Ayurveda is as physical, as psychological as much as it is physical. So it Ayurveda deals psychosomatically, a disease psychosomatically. So all these in balance is known as health, is considered as health in Ayurveda. So these are the unique aspects, you can find in Ayurveda than in the other system of medicines. So, in continuation to our discussion today, we have a guest. Our guest today is an actually completed his MBBS. He's an MBBS doctor. Then he has done his BAMS. He has done his MD, and he's pursuing his PhD, and he is the chief physician and the founder of Sushruta Sanjeevani Hospital in Anand, Gujarat. So, and most resonating fact about him is he also believes in creating awareness of Ayurveda, which he is associated with Ayurveda Nidhi. That is an official website which teaches about Ayurveda and our basics of Ayurveda. So let's welcome our guest for today, Dr. Dhanvantari Jha. Namaste. Namaste, doctor.
Namaste. Thank you so much, Dr. Aparna.
Yeah. Thank you. Thanks for coming. Thanks
My
for coming.
pleasure. My pleasure.
Yeah. So my first question would be like, it's very, intriguing and fascinating for me. And for the viewers, he is the second generation Vaidya in his family. His parents are Ayurvedic physicians. And the thing is, why after completing MBBS you joined Ayurveda? That's really fascinating. And how did you incline towards Ayurveda, and what brought you here?
As you were saying, I'm a third generation Ayurveda practitioner.
Okay, third
Uh,
generation. Sorry.
yes. My grandfather, during 1950s, he did a formal education in Ayurveda. He took his 5 years into college, did his formal education into Ayurveda, and he was a physician with Government of India in 1950s. And that is where the tradition of Ayurveda came to our family. But before that, also, we were always related to holistic science practices. Then my father did his BAMS and MD in Ayurveda from the Gujarat Ayurveda University. And then, as you were talking about me, as a kid, we are always inclined towards modern medicine, took modern medicine, studied MBBS. And then, because since my childhood, I had seen my family practicing Ayurveda, people getting well with Ayurveda. By going to modern medicine college, I imagine like, oh my God, people do come to modern medicine doctors also, because I had always seen my family practicing so well, and people who follow or my patients that we had always seen from our childhood will always be going to Ayurveda first, even for the smallest of problems. So for me to imagine that people can also go to some other pathy was the new thing when I went to modern medicine, unlike the usual happenings that happen. And my father wanted me to study Ayurveda. So he got me an admission into Gujarat Ayurveda University, G.J. Patel Ayurveda College in Anand itself for BAMS. First year being a bit difficult because the formal way of education in Ayurveda is inclined towards modern medicine. So then I thought, okay, so this is very similar to modern medicine. But as soon as second year came, I understood that it is quite difficult, quite different actually, and quite holistic, because that is where we understand that, okay, herbs also are understood by the way of Vaspita for the properties, the Guna Karma Siddhant. And that is how holistic Ayurveda is, by not just thinking about your symptoms or your disease in the terms of Vaspita, but also thinking about how the herbs will act on your body, how the universe is located with these principles, or how it is associated with these principles. So that is how Ayurveda came into my life. I did my BAMS, always was inclined towards Kaya Chikitsa in Ayurveda. So did my MD in Kaya Chikitsa from Madhya Pradesh Medical Science University. And then I always wanted to do something for metabolic syndrome or diabetes. So I'm working on metabolic syndrome and Kapha Prame, which is very closely related. I know it is very difficult always to call a modern disease and compare it with an
Totally
Ayurvedic disease.
different.
Right. But still, the principles that we get in Ayurveda, so that is how deep Ayurveda is. When Ayurveda talks about diabetes or metabolic syndrome, it not just means an obese diabetic, but it also means a lean and thin diabetic. It also means a young diabetic. So that is how deep Ayurveda is and how it beautifully takes stool pramehi, krish pramehi, plus all these aspects, the Kafaj Prame, the Vatas Prame, the Pitas Prame, and how it is treatable, manageable, and incurable. And so Ayurveda talks about all these things very beautifully. So that is where we took preventive cardiology and metabolic syndrome, and I'm doing my PhD onto that at present.
Yeah, interesting, wonderful. And tell our viewers about what is Ayurveda Sankul and what is Ayurved Nidhi.
So Ayurved Shankul is a very beautiful institute set in by my father, established by my father in 1999. It's a group of organization, group of doctors who had come together, did great wellness effect things for Ayurveda, and my father led them and established this institute, which works throughout the year on the principles of Ayurveda. So the biggest festivals of Ayurved Shankul are the Neem Swaras distribution in the month of May during Ram Navami, the Chaitra Navratri, because that is the time when we get all the viral disorders. So
Yeah.
that is where this is the time when people from around the whole region, back then in 1980s when my father started practicing, there were very less practitioners of Ayurveda. People would either go to government jobs or they would do
Allopathy.
uh, allopathy practice or general practice that they usually call, because Ayurveda was not a viable way of earning money. But my father was always inclined towards Ayurveda. You can see that from my name, my brother's name, Dhanvantri and Shushruta. So he was
Yeah,
always
yeah.
towards Ayurveda. So that is where he thought that I will start this awareness, and this in this whole region of Charotar, Baroda, the middle Gujarat, Anand, all these Kheda districts, there was no practitioner of Ayurveda. So he set this institute here where we celebrate such festivals. Then in Sharad Ritu, we celebrate Sharad Purnima, where patients from across Gujarat come to us. On that day, we distribute free milk and rice flakes things to raise the awareness that this is the month of Pitta. If you are healthy into this month, you will remain healthy for the whole year. We also have 24/7 free Ayurveda consultation camp going at Ayurved Shankul Anand. It is again an effort by all the physicians coming together who are working for Ayurveda. And whatever my father earns basically donates to the institute, where this institute works for the propagation of Ayurveda day in and day out. And so it is a holistic institute. We also have a temple of Lord Dhanvantri, which is quite unique in Gujarat because it was not there before. You don't see, you don't find a lot of Lord Dhanvantri temples. So the campus has a beautiful Lord Dhanvantri temple as well. We have two big halls with all audio visual facilities, the Charak Hall and the Vagbhata Hall, where basically we have all the facilities. So any doctor, any Ayurvedic doctor from across India, across the globe can come here, take their classes, do their seminars, CMEs for absolutely free of cost, and Ayurved Shankul bears the cost of that. And not just that, all the doctors of Ayurveda, practitioners of Ayurveda can come to Ayurved Shankul, stay here for free for one whole week, eat their food for free. Every facility is provided by Ayurved Shankul. So it is just kind of an institute my father wanted to do, because the hardships that he faced during his starting of work as an Ayurveda practitioner. So he wants that no Ayurveda practitioner faces that kind of difficulty, and he gets everything for free from Ayurveda Shankul to propagate Ayurveda. And when you get that kind of support, you work better for Ayurveda. So that is Ayurveda Shankul actually.
Yeah, like wonderful. Like it may basically it promotes the prevention of health, like dinacharya and rutucharya. And for
Exactly.
our viewers, let me tell, Lord Dhanvantari is the god of Ayurveda. We treat, yeah, god of Ayurveda, and Dr. Dhanvantari's name is named on Lord Dhanvantari. So,
Right. So
and
always a pleasure, and you can say it's been you say luck, right? Uh, Born into such family, inclined towards Ayurveda, and then working into that field with that name uh, is always a very you can say satisfying feeling actually.
tell us something about Ayurveda Nidhi, your official website.
Right. So Ayurved Nidhi is an effort started by me and my wife. My wife is an MD Panchkarma doctor. So what we saw that since we were into Ayurveda, we were seeing a global increase in demand of Ayurveda across the globe, but very less options for people to learn authentic Ayurveda. So Ayurved Nidhi is a platform which we call as a treasure of Ayurveda, where you can come learn Ayurveda, take online courses, take offline courses, do retreats with us if you want to do something with Ayurveda. So we do patient consultations with it. We also do online teachings and offline teachings, wherein we have centers in France, Italy, Norway, and China at present. We are working on two centers in US and Canada as well at present for people to come and learn authentic Ayurveda from authentic Ayurvedic qualified physicians. What we saw initially was people from, I should not say that they are not qualified, but many times people from yoga or other therapies were teaching Ayurveda because there were no other options there. So with Ayurveda Nidhi, we are trying to build a team of doctors who can go there, do retreats, do official classes, and teach them authentic Ayurveda from the basic texts of Ayurveda, the Charak Samhita, the Shushruta Samhita, the Ashtanga Hridaya, Ashtanga Sangra, the Sarandhar Samhita, the Madhav Nidan, what we call as the Bruhatrayis and the Laghutrayis, right? So we wanted to introduce an authentic source of knowledge of Ayurveda, and that is what we are trying to do with Ayurved Nidhi, our platform, which is an online and offline Ayurveda teaching and consultations platform at present.
Yeah, is it for Ayurveda doctors or Ayurveda students, and or
Yes.
common people
So
can also enroll? Yeah.
right. So what we have designed it is we have designed it into two ways. If an Ayurveda practitioner, especially young practitioners, so we have an organization associated with us, the Youth of Ayurveda organization, where we also play a very important part. There, as I was talking to you, at present, the condition of formal education of Ayurveda is not up to the mark, and which is improving. I must say that it is improving. But at present, the practitioners of the doctors, very young doctors of BAMS, who have just passed out from their BAMS college, don't have that enough confidence to practice Ayurveda, and somewhere they get lost and then start practicing modern medicine or try to do something else. So that is also one of the parts or motive of Ayurveda Nidhi to involve these young practitioners and teach them through simple, smaller CMEs to motivate them to boost their confidence to practice Ayurveda. On the other hand, the general purpose of Ayurveda Nidhi is to take Ayurveda to common people across the globe. So, in that pursuit, since 2020, in India itself, we have trained about 1,000 to 1,500 practitioners of yoga, practitioners of other systems of medicine, practitioners of physiotherapy, know about the basics of Ayurveda. And you would be surprised to know that at present I have about 150 Indian modern medicine practitioners who are associated with Ayurveda Nidhi, who continuously take courses of Ayurveda Nidhi to learn and upgrade with Ayurveda because they have patients coming to them and they don't want to just simply deny that don't take Ayurveda treatment. So they are also learning on what is Vata, what is Pitta, what is Kapha. So it is more or less for common people, but also for such trained practitioners of other systems of medicine who want to learn more on Ayurveda. But yes, we are working for the US people, for the UK, for France, China. China, we have a group of about 550 students who are yoga practitioners or traditional Chinese medicine practitioners who want to learn Ayurveda. So it is more or less for in a simplified way where all the common people can also come and take these courses. We have masterclass series where we talk about a particular series. You go to our website, Ayurveda, you see a masterclass on diabetes, a masterclass on hypertension, a masterclass on headache, where they can understand the basics of Ayurveda. We don't support telling people that these are the medicines you use this. But what we want them to understand is this is how Ayurveda treats. And once you do and follow these diet and lifestyle according to your prakriti, you can find a good qualified Ayurveda practitioner around you and you go to them and get your treatment done.
That is basics to common people.
Exactly.
See, what I have seen is everybody has an opinion on Ayurveda. Whether they know about it, they don't know about it, they have an opinion on Ayurveda. And what you have to tell to people who say that Ayurveda is not evidence based, is just a
Right. So
katha which is transferred from one Vaidya to another Vaidya.
Right. So what is happening there, Aparnaji, is the modern world is based on certain evidences, right? The modern world is like you see more and more modern people coming to us and saying that, do you have proof of this? Do you have proof of that? Or like that, right? It is not just with Ayurveda; it is with everything that is happening in this world. But for that, there is a very beautiful saying in Ayurveda where it says "Pratyaksham hi alpam, aprathyaksham analpam," right? So what you can see with your naked eyes is very less. So are you going to question that, oh, I don't know if my pancreas is working or not because I cannot see my pancreas working. So would you believe that your pancreas is not working because you have not seen it working in your body? Or my brain is working or not? I don't know because I don't see it transmitting messages. So that is what I try to tell people. But yes, with evidence, with many things now, with the increasing demand for formal education of Ayurveda in Ayurvedic colleges, in postgraduate Ayurvedic colleges, in PhD Ayurveda colleges, you see that more and more uh, researches are going on. Just because we don't know that such a research is going on, it doesn't mean that it is not going on, right? Uh, a, a very simple example I like to give when modern doctors ask me this question is that, paracetamol can work only in 50% of the patients. Simplest of medicine, most abused medicine, acetaminophen, can work only in 50% of the medicine. And the research that was conducted for such drugs was into 80s or 70s or late 60s. And after that, not more research has been done. It is one of the biggest reasons why kidneys get damaged into people. There are many other things. I know I can be, it can sound like I'm abusing a particular system of medicine, but no. I am a practitioner and I have seen very good practitioners of modern medicine practicing very authentic medicine where they only prescribe even the simplest of medicines, the acetaminophen or the paracetamol, only when needed. Right? That is because it is one of the biggest herbs or medicine known to cause damage to the kidney. So, are we going to see that evidence? So, that is where you have to trust your practitioner, your qualified practitioner. But yes, certainly a lot of research needs to be done for patented medicines. Whenever there's a brand coming up with a new medicine of Ayurveda, I would certainly like to see a research paper there. But whenever there is a classical Ayurveda medicine, then you have to trust certain things. Yes, regulations also need to be increased or improved where companies making medicines, even with modern medicine, if a company which is not experienced making a particular salt or a drug, it cannot be trusted. Similarly, in Ayurveda also there have to be companies with strict regulations producing even the classical medicine, especially the Rasaushadhis, where we use purified mercury, purified lead, and people say, oh, it's mercury, it's lead, but it is not going to harm you if it is prepared properly. And when that happens, we have to see what evidences we can produce. In Ayurveda, one more thing that happens is it is a personalized medicine, right? A medicine, particular medicine may work for your cough, but it may not work for my cough because my prakriti is different. My reason, my dosha condition is completely different. So we also need to come up with more research protocols which are Ayurveda focused. Because one medicine or one size fits all approach would never work in Ayurveda. So that is also modern medicine. I'm glad that modern medicine is coming up with these principles now, with genome medicines, genetic medicine, or a particular medicine suiting your gene cannot suit someone else. That kind of medicine. So even modern medicine protocols are changing now, and let's hope for the best that these researches come with Ayurveda and Ayurveda can utilize these research.
Yeah. And I always say that what more evidence than a treated patient? I belong to, matlab, I have studied in Government Ayurveda Medical College in Bangalore. So there daily 500 to 550 patients come. We have the follow up patients as well. So why would the patients come? We can't fool people all the time. So why would patients come if they're not getting treated, or if they're not getting any relief? Why would they come back? So what more evidence than a patient, or the people coming to Ayurveda? And the most unfortunate part is they come to Ayurveda after trying all medications, like after trying all the systems of medicines. Like we have tried allopathy, we have tried homeopathy, then we are coming here, and we thought we'll give it a Ayurveda a try. And even though they're getting relief and they're getting treated, so what more evidence than that? I feel that.
Exactly, exactly. So that is why there are case studies, case series that we can publish, and that is where I feel the Ayurveda community has to up the game. So everyone is doing it now. Everyone is trying to document their cases, as you are saying that. In a larger institute, many times what happens is if I'm seeing like say 20, 30, 40, 50 patients a day, it becomes difficult for me to see that. So now I need to develop a team which can basically understand and document these cases and then present it on larger scales. Take modern medicine doctors. So what we have tried now is we have taken a lot of modern medicine doctors with us to work on the antics, the small things where the patients are there, where the doubts of modern medicine doctors are there. So we are trying to do that as well. So case studies and case reports, certainly, as you are saying, are the biggest examples or the biggest proofs that Ayurveda works, right? And we need to change. See, Ayurveda in the modern world is growing up, right? As the demand is growing up, certainly commercialization also increases. And with increasing commercialization, certainly there will be one or two players who will be mischievous. And there, the quality of medicines can get abused or may not be proper. But to say that this is evident on everything in Ayurveda would be a wrong thing because we also see a lot of modern medicines being abused in that sense because it's a huge market. In COVID times, we saw a lot of fake syringes, fake medicine. So, are we going to say that modern medicine in a whole is a sham or a scam? We cannot because it is life saving and always whenever the demands will increase and that demand is also increasing because Ayurveda is working. So that is the biggest example as you are saying. Absolutely.
Yeah, and you have done MBPS, so this question is very relevant for you. Do you think we should have an integrated approach or integrative approach? And to what extent should Ayurveda doctors participate in an integrative approach?
Right. So now integrative medicine is also coming up now with a lot of integrative medicine centers in China, in US, and now the WHO Global Center for Traditional Medicine in Jamnagar as well. But the problem or the issue, what comes there would be interaction of medication or as this is also a very commercial thing because a hugely demand in demand thing. So what is happening is companies are coming with Oh, paracetamol along with Guduchi combined together in a tablet form. So that is where we need to understand. That is where modern pharmacology would come into place to see if that kind of drug is viable or extra effective or with a lot of adverse effects or side effects. And more or less that becomes modern medicine itself. It doesn't, somewhere Ayurveda will lose its shine there. I won't say tell Ayurveda doctors to not get involved into it, but I would ask them to first access the whole patient in an Ayurvedic way. On the other hand, the modern medicine doctors accessing the same patient in the modern medicine way, making their diagnosis. But there you will have to be truthful that if this modern medicine is a better alternative to Ayurvedic medicine, or this Ayurvedic medicine is a better alternative to the modern medicine. So there, both the parties will have to come together, think of a unique solution where you are not randomly using paracetamol as well as Guduchi, but instead accessing the patient properly, seeing the patient in a whole, and seeing that at which point of time which medicine will work, where the diet and lifestyle of Ayurveda can be introduced, where the medicine of modern medicine can be introduced. So that kind of approach, if it comes, then I am in favor of integrative medicine. But if an approach comes where modern medicine diagnoses and Ayurveda treats, or Ayurveda diagnoses and modern medicine treats, then it is not going to make any sense. It is only going to do harm to the whole thing, to the whole cause actually. Integrative medicine would be a medicine where you see the same patient with both the lenses and then decide what is best for the patient and do that treatment. And whenever that doesn't work, you go to the other medicine path.
Yeah, why I ask this is here, in some hospitals there is like, they will treat cancer with chemotherapy and radiotherapy and etc. Whatever treatments are there, then they will come to Ayurveda. That there they have an integrative approach for the palliative, this chemotherapy concept in modern medicine, and the palliative diet and nutrition ka thing in Ayurveda. So, is that approach you think, in your opinion, is going to work, or long time it is good, or that approach? How do you feel like?
Right. So this is where I always feel that the principles of Ayurveda, where they say that a disease is untreatable. Ayurveda, so that is also a misconception in many people's mind that Ayurveda says everything can be treated. No, Ayurveda also says at many places that this disease is untreatable. You just have to manage the patient, give him a good quality of life. Right. On the other hand, there are places where in Ayurveda, the Shushrut school of medicine comes into place, where they say that many places there are where there is surgery needed for them, right? And similarly, in cases of carcinomas, tumors, cancers, what happens is many times when a patient directly goes to an Ayurveda doctor, they fail to understand that even in Ayurveda, sometimes surgery is advisable or this patient is untreatable. So that is where we can certainly refer the patient for a chemotherapy, especially with modern medicine aspects when I try to use my modern medicine principles into cancer patients or carcinoma patients. Metastasis, right? The TNM classification, where metastasis M1 comes into place from M0, it certainly becomes untreatable. It is certainly incurable, right? Because the metastasis has happened into the liver or the lung or any other organ. Generally, the two organs which are very prominent for metastasis, right? So that is where I feel chemo or radiation comes into place. And once that has been done to avoid or to stop the side effects, adverse effects of chemo or radiation, Ayurveda can come into place. And mostly in modern medicine, we say that to improve the quality of life is the most important goal there. Because the 5 year life or the 10-year life of the patients of certain types of tumors or cancers are going to be very difficult, right? So there, improving the quality of life, Ayurveda can play a very, very important role. But in certain cases, there are certain tumors where chemotherapy or radiation can make worse the things for the patient. And that is where Ayurveda can certainly play if it is again, accessing the patient completely by Ayurveda and being truthful that this is going to get cured. So when the truth of that comes into place that yes, it can be cured even according to Ayurveda, there are references, then certainly go with Ayurveda first and then if needed go for chemo or radiation. But in places where metastasis has been there, then certainly chemo or radiation comes first, and then just improving the quality of life, trying to elongate life. We do treat with a lot of cancer patients as well, where especially the blood cancer patients, the leukemia patients, where there are very less chances of the patient surviving a 5 year mark, but has a very bad lifestyle or very bad quality of life, especially with children with leukemia. There, improving the appetite, improving the quality of life, Ayurveda plays a very important role. And here in Gujarat, we have cancer centers in Ahmedabad where if they get leukemia patients, they send them to us and say that, okay, we cannot do a lot of things here. So we want you to improve the quality of life. So that kind of partnerships will also come into play. And their cancer patients can be treated into that way. So once it is incurable or untreated or untreatable, then Ayurveda can certainly have a much better prognosis with the improving the quality of life.
Yeah. What do you think? You've worked in the West, like in Europe, France. So, how does West perceive Ayurveda? What is the scope of like global Ayurveda?
Right. So initially, I'll just share a personal story there. Initially, in 2017, when I started traveling to France, Italy, and Norway, there was a huge resistance. So we have a small center in Corsica in France. It is a island in the south of France, and a huge resistance. Like we were going and we were told that, oh, be careful with, watch your words, don't tell this, don't tell that, don't take patients or don't do this or that. And from the authorities as well, our initial visas were denied because our whole schedule of Ayurveda teaching and consultations was out. And then someone who was related to them helped us get the visa and everything happened, the Shenzhen visa. We entered from Italy. And once we started, at present we see most of modern doctors coming to us for problems or learning Ayurveda. Initially, there were only people who were practicing yoga there coming to us to learn Ayurveda. Now there are kinesiologists, physiotherapists, and at present we have about 8 to 10 modern medicine doctors in France as well who are coming to us to learn Ayurveda. So initially there was a resistance, but as they saw that in many cases, because there was abuse of certain things, when you go to France, what I have personally seen is the blood pressure of patients are extremely high. Even for a patient coming for a skin disorder, autoimmune disorder, which is also a gift of wrongly practiced modern medicine, I would say. So that autoimmune disorders, when patients of that come to us, and when we treat them just simply with diet, lifestyle changes, initially when they get results with certain simple herbs which are legal in Europe, then they understood that okay, this there is something with this medicine, and then now we have modern medicine doctors as our patients there, as our students there. We have a team of 8 to 10 doctors that I told, who continuously be in touch with us and ask us that what would Ayurveda do there. So now that understanding of Ayurveda is growing slowly as a holistic medicine because many chronic disorders are there where modern medicine doesn't have answers, right? Liver disorders where regeneration of liver is possible. Modern medicine knows that. But how is that regeneration possible? That they don't know because of very limited options regarding the medicines, right? And that is where Ayurveda can play a very important role working on the pitta, working on yकृत, working on pliha for this regeneration of liver cells, for this regeneration of pancreatic cells into many conditions. So now that as they are getting that thing, so now whenever we go, we have the mayor of that city coming to receive us. So that is increasing. That's because they understand that yes, at some point of time, at in some chronic disorders or like most of the modern medicine lifestyle disorders, Ayurveda is the only answer to these diseases. So now that demand or you can say awareness is increasing, and so now it is much better condition. So now we have very good response, very good reception in France, especially. Initially, when we started with this in China, same thing happened. The traditional Chinese medicine is very hugely popular there. So
Yes.
that is where a bit of resistance and also a welcoming thing came that, okay, so this is also very similar to our traditional Chinese medicine, the Ayurveda. And so maybe they have certain answers to certain principles of certain medicine things that can be done there. So now the awareness is growing. So now nowadays I see many people going and practicing. But my only request there always again remains the same, that try to use classical Ayurveda, authentic Ayurveda. And once you do that, you will naturally get your clients, your students, everything. And it's a huge world and the demand is huge. So I feel all the existing colleges of Ayurveda, if they start sending their practitioners or their pass out students to each and every corner of the world to propagate Ayurveda also, the demand won't be met. So it is a huge demand now with increasing awareness. So be truthful to Ayurveda and Ayurveda will take care of you. You don't need to worry about
Like you're saying that there is a significant improvement in the awareness and in the
it.
reception.
Absolutely.
Is it legal to
Absolutely.
practice Ayurveda there?
So now what has happened is in France there's a system called traditional medicine, right? So you go to Paris, you go to Nice, you go to south of France, Montpellier. You see, every Sunday, every Wednesday, there are Wednesday markets, there are Sunday markets, and you can open your shop with herbs out there because it was practiced into olden days. You have your herbs, which are many of Ayurveda herbs there, but you cannot say that this is into this disease. It is still going to come. There's still a huge resistance from the government, from official government. You go to UK. UK is BAMS is a legal degree in United Kingdom,
Hmm.
but you cannot advise or cannot prescribe Ayurvedic medicine. You can advise them for diet. You can open a huge hospital for Ayurveda, but you cannot prescribe them medicines. You can practice Ayurveda. You can legally say that you are practicing Ayurveda in the UK. Switzerland has opened up for Ayurveda in 2015. So in 2015, they made Ayurveda legal there. In Germany, there are huge palaces converted into Ayurveda Panchkarma centers. External therapies are absolutely allowed, but you cannot prescribe. UK, you can, up to some extent, advise certain herbs, but cannot prescribe. In Europe, because of system of traditional medicine before 200 years, herbs are allowed. You cannot say that this is this, this is this. You can make online teachings, offline teachings there. That is a legal way. Many countries are opening up for Ayurveda now. UAE has complete legal system of Ayurveda. You can advise, you can do panchkarma, you can prescribe, you can do everything. You just need to pass a Dubai Health Association examination, DHA examination, and you can practice that there. Australia had a this thing initially when we started, we did for Australia as well. Australia has an Australasian Association for Ayurveda, which is working for that. US also has many associations which are working for legalization of Ayurveda. But at present, there's a huge resistance from government. But with increasing intervention of the government of India by showing interest into Ayurveda, it is improving a lot now. But yes, still prescribing is with huge resistance, or legality is a huge question. But as I said, many countries, Dubai, Switzerland, Germany as well, up to some extent, UK up to some extent, Australia up to some extent, you can practice it
Yeah,
with limitations.
of course. Yeah, that's a good news though. But one thing is, most of common people think that herbs, ginger, tulsi, haldi, all this is Ayurveda, and the kadha part is Ayurveda. When we talk of authentic Ayurveda, this question is for a common man. How should a common man perceive Ayurveda, like authentic Ayurveda? What is your
Right. So
answer to them? Yeah.
absolutely, absolutely. And that is why I said we in Ayurveda have launched a masterclass series where we talk about a particular disease, but then we don't give you medicines or herbs. We tell you that yes, this can be helpful for you, but we always say that go to an Ayurveda qualified Ayurveda doctor. As you don't, we know that modern medicine has been abused. You go to a simple pharmacy and you get OTC, over the counter medicines, which is still possible in India. Outside India, it is not possible for you to get any Schedule X drugs. But in India, it is still possible. But we always see that such patients suffer a lot. Their problems increase a lot many times with simple things like turmeric, ashwagandha. People say, oh, these are safe, I can always consume. But for a pitta person, if you have acne, if you have a liver disorder, if you have acidity issues, you consuming turmeric or ashwagandha can be worse for you because these are hot potency drugs. So you cannot go and rely on online things, sources to uh, start taking herbs. These herbs are extremely powerful. And whenever something will work, it will also work into the opposite way when taken at wrong time into huge quantities, or even in lesser quantities, it won't work. So you have to rely on a qualified Ayurveda doctor for that. So your source has to be a qualified Ayurveda doctor. Now you see in India across states, there are many Ayurveda colleges, hospitals. Go to an Ayurvedic college, get an Ayurvedic consultation. Most of the times, these Ayurveda colleges provide free consultation. So you don't even have to worry about that. Don't trust online sources. Don't take. We also see that patients come to us with diabetes and say, "Oh, I'm taking this methi ka powder, Karela, jamun, neem, and everything." We saw this on TV said by someone or somebody else, and I always say that please, first thing is you stop all those things because this will always create adverse effects, side effects, and a lot of other issues when you take them without any consideration of your prakriti, of your vikruti, of your present state, of your agni, your digestion, your metabolism at present. It is not going to work for your body. So why take that risk when you get a free consultation by a qualified Ayurveda doctor? Go to them. Nowadays, there are online consultations with Ayurveda doctors. Go to them and take that online consultation. It is not going to harm you at all, but it will help you. Instead of taking that homemade recipes or that homemade that dadima ka nuskha, that is not Ayurveda. Ayurveda is a very scientific way. How Acharya Charak has made it, how Acharya Shushruta has made it, how Acharya Agnivesh made it, how Acharya Bhagvat made it. They have scientifically told us to use a particular herb into a particular quantity at a particular time in a particular patient. It cannot be used for everyone. Your cough medicine cannot work for someone else. Someone with a Vata diabetes, when they take Karela Jamun neem, their weight will lose. They will end up into diabetic ketoacidosis. Please don't do that. Go to a qualified Ayurveda doctor. Get a proper Ayurvedic treatment. Very easily accessible these days. Don't rely on online sources. See if the doctor has done a BAMS degree and then he is practicing. I'm absolutely fine with a BAMS doctor as well. You don't need an MD PhD doctor always. BAMS is quite good, well qualified for you to treat. many diseases. So go to them. They are always and mostly honest with their words. So they will only guide you in the correct way. So your source would be, yes, you can read your diet, your lifestyle changes that you need to do with your diseases, but don't do all those nuskhas at home. Uh, I can talk more on this because, COVID was such a time when many gynecologists who are working with us, modern gynecologists who are my friends or colleagues who know me very well, would call me and say, Dhanandri, what is happening? Females are having heavy periods. Uh, Pimples are increasing into young females. Heavy DUB, dysfunctional uterine bleeding is there. Do you feel there is some relation with Ayurveda? I say yes. The kadha that was very wrongly propagated, people started taking unknowing their prakriti, their vikruti, their body type, started taking these pepper and cinnamon and turmeric and all hot potency medicines, and that increased pitta or heat in their body. And I explained them that that is first needed to be stopped. And gynecologists would say, you are saying that Ayurveda medicines are causing this? And I said, yes, sadly that is there. Don't take any such thing without getting an advice from your qualified Ayurveda doctor.
Two misconceptions I would like to highlight for our viewers: that Ayurveda is not just the medicine available at home. So please don't self prescribe for everything. And second misconception is people say Ayurveda has no side effects, but Ayurveda has side effects when you take wrong medicine for the wrong disease or wrong medicine for the wrong Prakriti patients, or it also causes serious side effects. So please don't think that it doesn't have side effects. It doesn't have side effects when it is prescribed in a correct manner by a qualified physician.
Absolutely, absolutely. And overtaking medicines also many times, many people misunderstand between side effects and adverse effects, right? Ayurveda certainly doesn't have adverse effects
Hmm.
when made well, the medicine. But yes, side effects, anything which will have an effect, if you overuse or use it wrongly, certainly will have a side effect, right? But you have to be careful. Certainly much better and safer than the modern medicine, I would say, but still, if you get your treatment from the start with an Ayurveda practitioner or qualified Ayurveda practitioner, you will get rid of that disease very fast as well. Third misconception, if I can add, would be Ayurveda is slow. No, it is not. If you are diagnosed properly by an Ayurvedic doctor, if you are given the proper medicines at the proper time, and you follow the diet and lifestyle prescribed by your Ayurvedic doctor, then that disease can even go within 1 day or 2 day also. Your chronic diseases will also show symptoms. Yeah, I would talk about yesterday itself. I had a patient last week, and I had called them for a follow up the next week, right? It was a migraine patient. Oh, since 8 years, I have this issue and all and all. Within 8 days, she came to me and she was like, "Oh, my pain has gone, and how come this is possible? I was taking modern medicine for so long now. Even modern medicines are not working for me. So how did this happen?" So I said, that is the misconception about Ayurveda. If you understand that this is a pitta disorder, if I tell you that avoid sour, spicy, fermented, and fried foods, take these medicines, that too would be like one pinch of medicine, one tablet of medicine. Then how did this happen? It happened because the diagnosis was correct. Your medicine that was needed for you for this time was correct, and that is why you will get your results very fast, very fast.
Yeah. When we talk about Ayurveda, Panchakarma also plays a very important role. What do you have to say and how do you explain Panchakarma to common people?
Now, Panchkarma is a very wonderful therapy of Ayurveda. Acharya Charak, especially written by Acharya Dridbal into the Siddhisthan and Kalpsthan, explains very nicely about Panchkarma. Panchkarma, many times people come to us and say, I want to do Panchkarma. So that is also one
Maybe
thing which is not.
Panchakarma means massage and spa mainly here.
Exactly. So that is not Panchkarma, but it is side therapies of Ayurveda. Panchkarma, basically, I would like to call it as a therapeutic cleansing or a therapeutic detoxification. Detoxification is not the correct word actually, but yes, into a sense, it does detoxify a lot of toxins out of your body. Toxin removal is a different story. How the Grispan or the Purva Karma of Panchkarmas. In Panchkarma, we have three basic stages, I would say. The Purva Karma, Pradhan Karma, and the Paschat Karma. All three being very important. The Purva Karma has, for especially therapies like therapeutic emesis or therapeutic purgation, which is Vaman or Virechan, respectively. Then comes Basti treatment, the enema, Ayurvedic enema again is very different from the naturopathic enema or the modern medicine salt water enema. Because here it is a route of administration of drugs and not merely cleansing your bowels or detoxification, right? We want to introduce certain medicines into your gut which can get easily absorbed into huge bioavailability. So that is how we use enema. That is how we use Vaman Virechan. So Panchkarma is a beautiful technique, but using it at a starting stage where the doshas are not very strong is also wrong. But where the Bahu dosha condition comes, where the doshas are very, very strong, there Panchkarma certainly plays a very important role at the start to remove that excess of dosha. And then you continue with the oral medication, which will help the patient recover faster. Panchkarma therapy is basically the massage and all these things, Shirodhara, all these things are external therapies, may help you in certain conditions, but they are accessory Panchkarma therapy. The Panchkarma, like Vaman, therapeutic emesis, where we make you to vomit out the vomitus. It is specially targeted on the Kapha dosha, where you have heaviness, obesity, certain diseases like diabetes, sometimes asthma, breathing issues, where Kapha is the main dosha involved. So there also you cannot randomly go and do anything. Yes, if you want to do it according to Ritucharya, that in spring you go for Kapha, but that is for a healthy individual. Even if you have slightest of acidity, slightest of headache regularly, then you are not healthy. So then don't go for even those cleanses. So then you need to first treat off your that condition. If you are healthy, go for a Ritu Shodhan, spring, go for Vaman, during Sharad, go for during autumn, go for your Virechana. That is quite often quite possible. But if you have any symptoms, slightest of symptoms, go to your doctor, decide your cleansing, and then go for that. Only if needed. That also only if needed. Not all patients are suitable for Panchkarma therapies as well. But yes, Panchkarma is certainly a very, very important factor in treating diseases where doshas are increased very much. The power is very much, the patient's power is less sometimes, but patient is suitable for Panchkarma or Shodhana, cleansing basically, then it can be done and it is a wonderful therapy of Ayurveda. You cannot do all the Panchkarma for everyone. Yes, certainly for your particular dosha, you will need a particular Panchkarma therapy, which will help you for treating your disease. It is not a permanent cure, but it will help you not suffer from that disease again. It will start the treatment, and with your oral medications, Panchkarma will be a boon for you. It will help you recover faster. It will help you not have recurrence of that disease, and it will do a lot of cleansing, will bring you back to your normal life, and will let you enjoy your life to the full.
Yeah. Basically, Panchakarma is structured purificatory process. It is not just a massage and spa or the external therapies. It needs to be done under a prescribed doctor. So, my
Absolutely.
last question for the session is, usually patients and people ask me that when should I, when we say that people come to us after going to allopathy, homeopathy and all, people ask me, when should I approach an Ayurvedic doctor? In what diseases should I approach? How do I know that I, for this I have to approach allopathy, for this I have to approach Ayurveda? Basically, this is the question. What do you have to say for that?
Right. So I always tell my patients that if you have slightest of symptom, first go to an Ayurvedic doctor, because Ayurvedic doctor is someone who knows bit of both the worlds in a sense, and they can guide you that okay, this is the condition. You need an emergency treatment. Go to a modern medicine doctor. This is the condition where modern medicine has to have certain limitations, and that is where Ayurveda works. It is a matter of trust as well. It is a matter of choice as well. What we see in our practice, as I was talking at the start with my story of Ayurveda also, that once the patient starts trusting an Ayurvedic practitioners, once they understand the power of Ayurveda, they will certainly not go anywhere else. And they, for the slightest of fever also, they won't take paracetamol but go to an Ayurvedic doctor because they understand the nuances of the medicine and the treatment that Ayurveda can give, right? So it is a matter of choice as well. But I would certainly say that once you have a chronic disorder, a lifestyle disorder, hypertension, diabetes, liver disorder, all such issues, arthritis, metabolic syndrome, headaches, where the answer by modern medicine is quite limited to certain things, there Ayurveda certainly plays a very, very important role. For a headache, instead of giving you a non-steroidal anti-inflammatory drug, NSAID, or something like a painkiller or something or the other, which cannot be used for a longer time, even by modern medicine, there, instead of exploring such treatments, explore Ayurveda, try to improve your diet lifestyle modifications, and that will help you with your such disorders. When you have diabetes, hypertension, where modern medicine asks you to consume medicine throughout your life, uh, thyroid diseases, where modern medicine asks you to take medicine throughout your life. There, take your modern medicine doctor into loop, take them on board, and ask them that should I try Ayurveda at some point where I can go medicine free. And that is also a place where, and one more thing with these disorders, diabetes, hypertension, and thyroid, I would say that first, before starting modern medicine, start with Ayurveda, because many times when modern medicine has been started, certain effects of Ayurvedic medicine, which has to be coming very fast, will come late with the start of modern medicine. So there, first start with Ayurveda, and then if it is not getting controlled because of many different reasons, then start with modern medicine, and along with that start continue Ayurveda. Otherwise, Ayurveda would be the treatment of choice there. In cases of emergency treatments, certainly modern medicine is the way. You have hemorrhage, you have bleeding, you have certain appendix burst, you have certain kidney stone burst. Certainly, you have to go to modern medicine there. You have fever, say, above 104 degrees Celsius, above 102 degrees Celsius, where chances of your brain cells getting damaged are very high. Certainly, modern medicine is the way there. Ayurveda can help, but would be along with that modern medicine, because emergency medicine is something which is the core of modern medicine, and that is where modern medicine can help you more. But otherwise, I would usually say that if you are capable of walking by yourself, going to a clinic, go to an Ayurvedic clinic, and then let the doctor decide that if you need a modern medicine or not.
Yeah. Basically, I tell my patients to have a 80-20 approach. Like 80% of the chronic illnesses and the illnesses can be managed well and treated by Ayurveda. And for the 20%, we need all other systems of medicines. And for the
And
viewers,
other thing is absolutely ask questions. I won't say that when I say that go to an Ayurvedic doctor, don't trust them blindly. Ask them questions.
Yeah.
Ask them thousands of questions that, okay, this is the dosha, this is that, because that is our duty to explain you what is vata, what is pitta, what is kapha,
Right.
how
Right.
it works, how your condition is there, why I am asking you to stop this food. When you ask that question, your Ayurveda doctor answering you will build your trust. And when you trust, we say in Ayurveda that a doctor's quality, a patient's quality is Vishabhashya. You should be under the control of doctor, but not blindly follow them. It is about understanding their knowledge, understanding your disease condition according to Ayurveda. And once you do that, you are certain to be cured by Ayurveda for sure.
Yeah, and other thing is like Ayurveda is the only science of life. Like it approaches both in the qualitative and quantitative aspects. Like Ayurveda does not only believes in adding years to your life, but it adds life to the years. So I think this would appropriately suit. And don't
Perfectly
just
summed.
trust everyone. Even if you go to a doctor, don't just trust the doctor. Just ask questions, and instead of googling, please go to the doctor. Googling everything, please go to the doctor, because Google does not have answers for everything. When it comes to Ayurveda, at least it does not have answers for everything. You can't Google everything. So
Absolutely. Now there are going to be AI doctors as well. So
yeah.
so with huge limitations, it is going to be there. So always, this is a personalized medicine. Even for medical field, we say that don't trust Google. Don't go with Google for that. When your doctor gives you something after explaining you what fit and cuff, your condition, how this herb works, and after that, when you go to your doctor and say, Doctor, आपने अश्वगंधा क्यों नहीं दिया, then that is wrong. Don't do that. Once he has explained you everything with your medicines and everything, then trust that. Because then there are many, many different things the doctor has to think about your body as well.
Yeah. Thank you very much, Doctor. I thoroughly relished the session. I think viewers also got relished the session. And thanks for giving us information and for explaining us. Thank you. Thank you very much.
Thank you so much, Dr. Aparna. It was really a very nice conversation. Uh, Everything that we talked, things came up, and I'm always very passionate about Ayurveda. So it always gives me huge pleasure when it makes me explain Ayurveda to people, how it works, what it does to your body. And I certainly say that follow Ayurveda, live very well. Ayurveda for life, Ayurveda for all. And thank you so much, Doctor. Very nice
And by
conversation.
the way, this
Good on.
interview was impromptu. It was nothing was scripted here. Everything was live and everything was impromptu. Thank you.
Thank
Thank
you so much, Doctor. Thank you. Namaste.
And yeah, to all our viewers, thank you for staying tuned. And all my consultations are online. And you can DM me if you want a consultation, and I'll give the mail address. So thank you. Thank you for staying tuned. I'll be back with another session next week. Thanks. Namaste.